Hey, kids cook real food. Katie Kimball here for the Healthy Parenting Connector, where as always, it is my goal to connect you parents who so desperately want to raise healthy, independent adults to the experts who have the information you need. I am so happy today to be talking to Dr. Hokehe Effiong about kids with specifically inattention difficulties and behavior difficulties because of that. Some might toss the label of ADHD around, and we're going to get into that a little bit today. Thank you so very much for being here, Dr. Effiong.
My pleasure. Thank you so much for having me.
So let me introduce you a little formally to Dr. Hokehe Effiong and her background. She's board certified in pediatrics and helps families with children who have those symptoms of hyperactivity and inattention. But I love what she does. She's not just kind of your standard prescription writing doctor, which, you wouldn't expect that here at the Healthy Parenting Connector. Anyway, Dr. Hokehe Effiong is so committed to getting to the root cause of these kids' behavior so they can improve their attention, so they can improve their listening skills, both at home and in the classroom. Music to many parents and teachers' ears, I know. She wants these children to excel, to flourish in mind and body, and not just the child, but the whole family as a working system. Um, Dr. Effiong also runs a nonprofit called Kids of Hope. And this is so cool. This is for kids in the foster care system to try to bring love, hope, and dignity. Kids of Hope gives children in foster care a bag with brand new comfort and essential items that they can call theirs. We know, and we'll be sure to link to Dr. John DeGarmo's interview, that foster children sometimes have nothing and they have no one, and they to have something to call their own. Dr. Effiong, I just know that work is so very important, and a handwritten card telling them they're loved and cherished. I mean, this literally may be the first time that these kids have heard the word love for them. So, love the nonprofit, love what you do as a doctor with your pediatric patients, and also, and maybe more importantly, when not working, Dr. Effiong can be found chasing or being chased by her three little angels, reading books, singing, dancing, and traveling with her family. Of course, we're filming this in COVID, so traveling's not happening as much, but they're still chasing. Goodness. Well, thank you so much for being here. I want to hear a little bit of your background, how you ended up with sort of that special focus on kids with inattention and ADHD.
Okay. Yes. So, like Katie said, I'm a general pediatrician, and I do have a backstory though. So when I was in college, I was in third year of medical school. So I was in two car accidents 6 months apart. So then I was told by the neuropsychologist who I got sent to because I just started not doing well in school that I had some brain injuries, and so he asked me what I'd like to do, and I said I wanted to be a pediatrician, and he said you'll absolutely not make it to medical school. I suggest you go look for something else to do. So that hit me really hard. I was 17 years old at the time, and I was like, this is all I've dreamed of being since I was 5. So of course, I believed him at first because he's the doctor, and
Mm.
I definitely didn't do well in school. So, but my parents kept telling me there was nothing I couldn't do, and that my mind was fine, and that I could make it. And so here I am.
Oh
And
my goodness.
so, when I started practicing, just in the last few years, I've noticed that more and more children are being diagnosed with attention difficulties and not being able to focus. And the children I've seen, lots of them feel like they can't make it. Well, they and their parents both feel the same way, that they probably can't make it. How are they going to function in life? Um, are they going to be able to get good jobs? How are they even going to pass third
Mm.
grade? Because they're having so much difficulty.
Sure.
So my heart just got drawn to this group of children who just feel like they've been told no at every point and they can't make it, which is kind of like my story. And so that's what made me reach out and just start trying to figure out, okay, what else can we do for our children with hyperactivity? The medications don't seem to solve the problem. I mean,
Mm.
it helps them for a few hours and then we're back to the same problem, right? In the evening, it's like the parents can't do anything because
Yeah.
the children are right back to where they were. And so I just started searching, and a few patients asked me questions like, okay, so one parent came in and told me My child isn't sleeping. And I said, okay, the clonidine and the usual stuff we do. And that didn't work. And then I just said, okay, hold on. So I Googled natural ways of helping children sleep. I was like, what? So I was amazed at the amount of stuff out there. I'm like, wait, it says natural pediatrics. She's not even a pediatrician. What in the what am I missing here? So
Uh,
I told them lavender, and they tried it and they said it worked. I was like, wait a second. So I that's what made me really start going to find resources, and I eventually did training just on functional medicine for ADHD because I was like, wait, there's ways to actually help children, but not just looking at the symptoms. What's causing the symptoms, you know? So it's been such an interesting journey, and that's why I just love to work with this particular set of children. But in addition, I have a child who also can be inattentive, and
mm,
what I found through my research and all the studies has been helping her. So I haven't even had to put her on medications, but she's able to walk through her walking through her not being able to focus well. And I just want to share it with the world. I have this big goal of helping a million kids with ADHD get able to focus better. So
and there are more than a million out there, right? Like they are out there, they're waiting, they need
counting, and
you.
the numbers are going up daily. Yeah.
Yeah, I mean the statistics on ADHD diagnoses, am I right? It's a very, very sharp upward trajectory.
Yes, it is.
Hmm. Well, your story, I mean, I was just reacting over here like, oh, two car accidents, and for that doctor to tell you that. And of course, we listen to our doctors, and, but way to go for your parents to say, no, 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 we don't have to listen to the no's. We can give you our yes and give you our support. And, your brain was fine. You did it. And so that's amazing. And I love the story of a doctor Googling and learning right, all these things that you didn't learn in your conventional training, which
Yeah.
is,
I mean, I
it's limited. There's only so many hours you had. So what a great eye opener. And then to go back and be functionally trained, which is again so cool that you have sort of both pathways
Mhm.
in your background. I feel like that means you have a bigger toolbox,
Yes.
than people who have just had one or the other. And I'm very excited about this, partly because in my own life, like an old friend literally just asked me last week, oh, my kid just got diagnosed with ADHD. Like, do you have any resources? I said, of course I do. And I went to grab a few best healthy parenting connector episodes. And then I realized, shockingly, I didn't have any specifically focused on inattention. We had, autism, pans and pandas, and anxiety, and things that are like, related, but not quite the same. So I feel very blessed to learn from your expertise. And I really want to make this interview like a rookie's guide to walking through what parents need to know most. So let's start at the beginning. Like, how should a parent first sort of assess and settle with a diagnosis, or maybe even know if they want to request an evaluation for ADHD?
Okay. Yes, that's the perfect place to start. So ADHD simply stands for attention deficit hyperactivity disorder. That means the main symptoms you find are inability to stay focused, yeah, inattentive. They can be hyperactive, but they can also be impulsive. They can also just be spacey, like not yeah, you're talking to them and they're not really responding to you because
Sure.
they're thinking about other things. So I mean, and the symptoms can be different for both boys and girls. There's a big myth that says girls don't have it, only boys have ADHD, and that's not true. Both boys and girls have it. It may show up differently. So the critical thing is, does this behavior happen both in more than one place? So, for example, does it happen both in school and at home? I've had so many patients, they walk in the door, they say, the teacher says I have ADHD, go get evaluated. And I'm like, okay. So we do the evaluation, and the evaluation usually consists of what's called the Vanderbilt form. So it's a form that's given to both the parents and the teachers, ask them to fill out what they think about the child's behavior. And then we, the pediatricians, look at it and score it. And based on the scoring, that's what gives the diagnosis of ADHD.
Okay.
But when you have the teacher's form saying, yes, for sure, this child has ADHD based on the score, and then the parent says, form is no, this child doesn't have ADHD. So it's like, okay, so who is right here? And so that's when, and that's what typically happens, is that we have to dig a little deeper. At least I try to dig a little deeper, like what exactly is going on. And that's what we're going to allude to later on for the root causes, because there's so many different causes of ADHD,
I
uh,
believe that.
or factors that can affect the behavior of a child. Yeah.
Absolutely. We're so complex. And I've noticed in just reading just even a little bit of what you write, I feel like you use the phrase ADHD symptoms and then struggles with inattention or hyperactivity. Is there something, do we want to be a little cautious about how we use ADHD as a label?
Yes, because that label automatically gives that child, it almost comes attached to it. You're not good enough, you can't do this, you can't
Mm,
be like, you're not like other children. Which I'm not saying there is nothing called ADHD. There is. And ADHD, to be clear, is a brain-based disorder. So brains of children with ADHD uh, function differently than the brains of children without ADHD.
sure.
um, the brain waves, children with ADHD have more slower brain waves than children without ADHD. So that's one big difference right there. But I find that when we just automatically give kids this label without actually looking at what's really causing it, because or what's really causing the behavior, because those behaviors can be caused by so many things. And I'll tell you more stories as we go along, but yes, they can be. So I always, when people come in with a pre-diagnosis of ADHD, I say, no, wait, hold on. Now I know more better, I'll do better, right? So we start
Mm,
asking questions to figure out, wait, is this really true, or is there something else feeding this behavior?
sure. Yeah. But yeah, when you think about the behavior as just the visible symptom, and it may or
Exactly.
may not be caused by the same things going on in the brain. We live in such a complex environment. So what do conventional pediatricians generally do right away if they do make a new ADHD diagnosis? And what questions should parents be asking right at that point?
Yes, that's a very important question. That's actually the title of my new report I did on ADHD. I'm making it into a book also,
Oh,
like what
nice.
your child wishes you would ask their doctor about ADHD. So a conventionally trained physician like me um, okay, so if the parent and the teacher matches and they both, the Vanderbilt, the forms both say this child has ADHD based on
Hmm.
the scoring. So typically next thing would be to discuss medications. Some parents don't want medication, some do, and there's different types of medications. There's stimulants, there's non-stimulants, but all to the end goal of helping the child focus better. And so that's typically what the next discussion will be.
And what questions should parents ask at that point?
Yes. So questions parents should be asking, especially when they're seeing a conventional doctor. And the questions they should be asking are, um, what are the possible side effects of this medication on my
Mm.
child? Does my child need to take the medication all day, all week long, or just for school? Questions like, will this affect my child's sleep? And what about feeding? Because a lot of the medications have side effects with appetite. It decreases the children's appetite. So, what strategies can I use to make sure my child's weight stays appropriate and my child doesn't start losing weight because they're taking the medication? And is there a way, at some point, would we reevaluate this to see if the child can come off the medications, or is this something that's lifelong? And oh, yes, the very important one. Can my child also go to counseling? Because behavior modification therapy, or CBT, has been found to be extremely helpful with helping children, or even like play therapy, helping them. Just the therapists who are trained to help children with ADHD will help them focus on their strengths and help them navigate all the challenges they may face with um, so relationships, with socialization, with helping them with executive functioning, things like that. So it's always a great idea to do counseling in addition to medication because the two together work better than one without the other. So
That is good to hear. Now that you are more holistically trained, is your first step medication or are there other methods?
no, my first step is definitely no medication. So my first step is a really long time spent asking you all sorts of questions.
Ah,
I'll give you an example as to why that's really important. I had a 12-year-old coming to my office with her mom. Mom says, teacher says my child has ADHD and, and she needs medication. So that's why I'm here. So my first question is, okay, she's 12. So has she had this problem? How long has she had this for? This inability to focus in class. And she's like, well, it's been going on for about a year. I'm like, really? Okay, so tell me more. What else is going? What are the things that she does? Does she do them both at home and at school? And then we talked about what's your home environment like? Where do you live? And how old is your home? And then mom says, hey, doc, you're gonna think I'm crazy, but listen to this. Everybody else in my family thinks I'm weird, but when insects fly into my house, they fall down and die. And I said, they do? She's like, yes. And even the dog lays on his tummy like he just can't, he like wants to pass out. I'm like, really? And I said, so how do you and your daughter feel? Do you feel sick when you're in the house? And they're like, yeah, we just got used to it. But yeah, we have mild headaches and just don't feel right. And I was like, how long have you lived in the house? Oh, we've lived there for a year. Is that about when her behavior issue started? Yeah. Oh my Lord.
oh my goodness.
So if I didn't spend the time to ask this mom what happened to your child, I would have handed this kid some stimulants.
Mm.
Instead, my treatment was please get your child, you and your child, out of the house. So she said she couldn't move, which I understand, but she was able to get her daughter out to stay with her sister. So her daughter was out for a week out of that house, and I saw them a week later, and there's no more inattentiveness. It's gone.
Oh my goodness. So there's something, mold or something in that house. Whoa, that's
So that's
scary.
why it's so critical to look at I mean, because yes, exposure to environmental toxins, lead, copper in the water, all of those can lead to symptoms of inattentiveness. Where if all we do is just ask the straight questions and don't ask anything else. Trauma, that's a big one I'm so passionate about because I'll tell you a story. I had a 6-year-old boy change names and ages just to protect him, but he was in foster care. So came into my office for an evaluation because they're moving him to a new home and he was bouncing all over the room. But the thing was, he kept coming back to me and saying, please hug me. He asked me to hug him at least 15 times.
Oh,
And I said to them, well, and then I found out this was his 17th home in 6 months. I said, oh, and that's the reason I started my nonprofit because I was like,
how?
I gotta do something to help these children.
Oh,
But I said to them after watching him and hugging him, I was like, I don't think he has ADHD. I think he needs love. And they looked at me like I had two heads. And I was like, just, okay, believe me, I'm not giving him any stimulants today. Just please find him a loving foster home. Can you do that? They said they would try. Okay, so I saw him in 3 months. He only asked me to hug him once. And he was sitting on the laps of his papa, his foster
mm.
dad called Papa. And there was no bouncing off the walls. There was no all over the place. He was just sitting and having a conversation with me. And I was like, if I had loaded this kid up with stimulant like I was asked to, oh my gosh, it's not that, it's trauma. Because the brain remembers trauma. And when children face adversities in childhood, it can because their fight or flight systems are so revved up, they can act like they are hyperactive. I
Wow.
mean, if you were moved from 17 homes in a short period of time, you too would be hyperactive. I mean, for lack of better way to, you don't even know how to handle yourself. So
Mm.
So that's, yeah, trauma is a big one for me because it's so critical, because it's so easy. They look so alike and so similar. But if you don't ask those questions or even have that at the back of your mind,
Right.
even trauma in the parents. So now I no longer just ask about trauma in the child. You parent, what happened to you? What happened to you when you were growing up? What happened to you when you were pregnant with this child? Because all of those things can, even low birth weight in pregnancy, which can be due to drug abuse or alcohol abuse, can also lead to hyperactivity.
Wow.
So,
Those
yeah.
two stories, Dr. Effiong, make they're so disparate, right? Similar symptoms. Teachers or parents are saying it must be ADHD, and we've got environmental toxins, and we've got emotional trauma. I'm sure there are a dozen or 2 dozen other completely different potential causes. So I love that you say just dig in. It's probably people are probably nervous to come to your office like, oh, she might ask me about my childhood. I'll have to lay down on the couch, just kidding. But so I mean, we've got these similar symptoms, hyperactivity, inattention. What baby steps would you tell a parent to take, maybe to begin taking steps toward helping their child thrive with these struggles?
Okay. So, yes, baby steps always start with we, the adults, as parents.
Mm,
So, what is it that you're, first of all, how do you see your child? That often helps because, yes, it's very easy for us to focus on the things they're not doing well. They can't sit still, they're not listening to us, they're talking back to us, or the behaviors. But I'm going to appeal to you parents to, now you know that with ADHD and their minds, their brains, they'll have slower brain waves. That alone should make you consider that, or remember that your child is actually trying and
mm,
they just need the extra help to and the support to figure out how best to act. But they do want to act right. So it's just changing that perspective of how you see your child, because if you're able to see past the behavior and just see your child for who they truly are, this loving child that you gave birth to, because ADHD is not a parenting problem. It's definitely not that you're a bad parent. It's just that their brains function differently, and so they need the extra help from you. They need to know that you love them. And then another big thing is listening, like really listening. I
mm.
know you hear people say listen, but really listen, because listening makes a great difference, because you're hearing, and the children will tell you. If you ask them, they'll tell you what they're struggling with. And so then now you as parents working with them, because it's so important for children with ADHD to feel like they're capable, right? So when you give them the choice or you say, hey, let's work on this together, then they're more likely to do that versus you telling them what to do and how they're not doing it right and what they need to do right. How about, okay, maybe give them two choices. How can we work on this and work this out better? So those are the two things, changing your perspective and really listening to your child. That will help get you and your child from place of maybe lots of friction to a place where you both connect.
And I think those tips they are simple but not easy, right? Simple to say and think about, not always easy to implement. And but parenting is not easy. And
Right.
so it's good to focus people away from, let's not start with the pill, a little thing, you pop that, it's easy, but it might not be as effective. And I mean, we have to talk about these natural ways, what that little experience with the lavender vaulted you into as a whole new profession practically. What are some natural ways to support kids with attention difficulties? I know I can't accept that kids need a prescription and only a prescription to be successful in school and life. So what have you found, beyond searching up sleep aids? What should people try?
So, there's several things. So, nutrition is a big one. So, since we're on the cooking food show, on the kids cooking show, let's talk about that. So, nutrition is a big thing because the gut or your tummy and your brain are connected. And what you put, food is medicine. And what you put in your tummy definitely for sure affects how your brain functions.
Mm,
And so that's one of the first places where I start is talking to parents. Oh, and with all the kids I've seen, I found that a lot of children with ADHD are also constipated.
Oh,
Constipated, it means that we're backflowing into the bloodstream things that should have been cleared out of the system. And so those things can travel to the brain and affect the child's behavior.
wow.
So I found that when I work on children's constipation, like increasing fiber intake, for example, things like eating more nuts or eating beans that has iron in it, yes, and it also gives you protein, and not being so top heavy with the carbs, but balanced and eating
Mhm.
more protein, some carbs, because we need one day of meals to be balanced. They are growing children after all. But I found that when we make changes in what they're eating and how much water they're drinking, because I like to make the connection for the parents and the kids. I'm like, your brain is 80% water. So if you drink more water, then your brain will be happy with you, right? And then you'll be, feel happier too. And that helps too with the constipation. So and then I like to put the children on magnesium, because magnesium is a very important element that's lost when you're constipated. So I put your children on that, make changes to what they're eating, what they're drinking, increase water. I mean, and we do it slowly. So it's not
Yep.
like, boom, here, you have to change your whole diet, because we all know that's not going to work. So maybe just change one thing. Okay. Can we try some almond milk instead of dairy? Because we know dairy can constipate too. So it's just slowly decrease it. And then I like go half and half. And then as the next week, add a little more almond and a little less milk, and just slowly. So it's a slow
Mm,
process. So we're not, because in the end, we want this to, I mean, we want the transformation. So we're not going to rush things. So
right.
yeah, it's just working on encouraging the parents themselves to not just see it as, oh, this is just for my child. If the whole family embraces it and wants to be healthier together, then I find that it works better. So
Ah,
one,
which is beautiful. Your focus on the family. It's not just one. If the whole family's eating junky just because one child happens to be, obviously showing inattention, the rest of the family, their gut brain connection's probably suffering too. And I love, you can tell that you say this to kids because you're like your tummy and your brain, you're not using big fancy medical language. You're saying it in words that kids can understand, and that's so important, right? And I, of course, I support baby steps, the little things. And really what I hear you saying is when we put good things in our bodies, when we dial, turn the dial more toward natural and real food, we can turn the dial down on some of that hyperactivity, some of that inattention. And I think that gives a lot of people hope.
yeah,
That's beautiful. And then you often talk about those root causes, which we've heard two, really spectacular examples of root causes of ADHD symptoms. But what do you see very often that's at the bottom of these attention difficulties?
sleep. I mean, ADHD could also be called the sleep disorder,
Whoa.
because lots and lots of children who have ADHD, they don't sleep well. So there's that whole connection going on, the tummy, the brain. If there's something going on in the tummy, then their brain is off, functions off. They don't sleep well because they don't feel good, but they can't tell you they don't feel good because they may not know how to describe that to you.
Sure.
But yes, so sleep is a big one. And so for my teenagers, I asked them point blank, so where's your phone? It's in my
At night.
And the mother is in my office saying, can I have some more clonidine? I'm like, no, you can't. Like, can you please take the phone out of your room and put it outside? I mean, out of your room. And it's amazing. They try it and they're back and they're like, yeah, he sleeps. Like, oh,
So, for some of these kids, I mean, there are physiological reasons that a body might have trouble sleeping. But for some of these kids, it's not even their body, it's just their habits. They're getting in bed too late, they're taking the phone to bed, they're on their screens, like just simple, simple stuff to fix.
yes, because the light from the screen stimulates the brain and that keeps them more awake. So they're not even going to be able to sleep. And yeah, and for those who really have trouble sleeping, I mean, I talk about routines, and yes, the lavender helps. I mean, even the magnesium I mentioned for
Mhm.
constipation helps with sleep. So it's just forming those good habits for the children and staying consistent with it. And I mean, sometimes I tell parents, yeah, you can play like soft music, but nothing stimulating,
Mhm.
and just make the room a comfortable place. Back to the basic old sleep hygiene, because that really helps. And definitely in this age of TV. Oh yes, TV is in the room. I'm like, get the TVs out of the room, please. They
Mhm.
don't need to watch a movie before they fall asleep. They can watch it in the living room and then go to the room, and the room should just be for sleeping. That's
Mhm.
magic that happens when we make our rooms just for sleeping. So
Yeah, I can't tell you how many times I've read information written for adults reminding us over and over, your bed is for sleeping, your bed is for sleeping. Like, don't do work, email, TV, blah, blah, blah in your bed. And so the fact that we adults are having to be retrained in what a bed is for, right? The culture is not supporting sleep. And again, I've probably done 100 interviews at this point about all sorts of things. We have a couple that are just on sleep that we'll make sure we link to, but many of our experts talk about sleep as a piece of the root cause for whatever disability we're talking about. I cannot emphasize more how important it is to have those good sleep routines. I mean, you're saying someone can come to you and say, I need a prescription. And you say, no, you need sleep. Get the TV out of your room, and half of your problems are going to disappear. That is amazing. That is powerful. And I have to say it again, that ADHD could be called a sleep disorder. You're hearing this from a pediatrician who's also functionally trained. Get your kids to bed on time, people. Now, my favorite prescription, of course, is teaching kids to cook. And we do find that a lot of kids with behavior struggles, inattention, who are on the spectrum, really thrive when working in the kitchen. So, how would you recommend parents to try to get their kids involved with that food, even though it can be more scary with kids who are impulsive or distracted when you think about knives and fire?
yes, so of course, as with everything, we start off slowly, right? But for sure, that's a really great area because it makes children feel like they've achieved something
Mm,
and they're competent at something, and they feel so good about themselves, and that transfers to their behavior. Then
yeah.
they even try even harder to act right, and you'd be amazed. So I would say just pick a simple recipe that has just a few, like 4 or 5 ingredients, nothing more than 5 ingredients, so we can keep it simple, and just a short list of what do you call it, equipment needed for
Mhm.
cooking. And maybe I wouldn't give them the knife the first time. Maybe make something that they don't need. They can cut the green beans with their hands, right?
Absolutely.
So just, just involving them in picking out the recipe, giving them a choice. They like the fact that you even think they're you think so highly of them that you offer them the choice. So if you give them a choice of the recipe and then they pick it out, and then you make sure it's a time where neither of you will be interrupted. And of course, with just put cell phones away, just give them your undivided attention, and you'll be amazed. And then just when you're going through the recipe, just maybe cover the parts you're not looking at so that they don't
Uh,
get their focus doesn't go somewhere else. So they just focused on the one line they're working on, and then you move it to the next line, and then that way they just stay focused on what the process is. And just, I mean, have fun with it,
mhm.
and just make it a give and take, like teamwork, like say, oh, so what do you think will happen when we add this in? And so they can, or what do you think happen? Oh, spices is a good one. Like
Yeah.
adding spices, and some lots of kids with attention difficulties may have sensory
Mm.
challenges as well. And so the spices and the aroma just plays with their senses and ask them if they can pick out one smell versus the other, say lemon versus curry or something like that. Just, I mean, it make it into a fun learning time and just a time of bonding. And for sure, yes, get the kids in the kitchen. And I even would say take them grocery shopping if you can. Well, it's COVID, so online, shop online together, and let them pick out the good some vegetables, because if you tell them it's good for their brains. Oh, you should have seen this kid light up in my office the other day. I said,
Oh.
Mom, he and his mom were gonna go shopping. I'm like, Mom is gonna buy you um blueberries and it's going to help your brain. He's like, help my brain. And he's 12. So it's not like he's just this little kid, but he was just excited because he knows he wants to do better. And
Mm.
he's just like, oh, yay, it's going to help my brain. Okay, I'm going to do it. And before then, he was giving me the attitude, the typical attitude. So it's like,
Oh.
they want to know that they have a choice and that they can do it. Like, my 3-year old, I tell her that blueberries are God's candy. So she goes around telling her older siblings, you need to eat some blueberries. It's God's candy.
Oh, that's so sweet.
So it's just teaching them, yes, how important food is and bringing them along on the journey, which I'm sure you found that it helps, definitely helps them.
Oh, absolutely. And I love the strategy of covering up the parts of the recipe that you're not yet using. You could just probably move a post-it down, even unless the recipe's too big. But and there are even I was thinking about the Real Plans app, which is a meal planning app, but you put your recipes right in there. And if I remember right, it might be Real Plans, it might be Plan to Eat. You can actually swipe one step at a time on a tablet. So you can only see the one you need. So that, I mean, that would be, super helpful, super simple. And, again, when we think about kids who are busy in their bodies, well, goodness gracious, they need something to do with their hands. So when you said just a few ingredients, immediately came to mind our Powerball recipes. So we have a bunch of different flavors, but nuts and dried fruit, basically, in the food processor. And then you got to make all the little balls. And it's sticky and it's tactile and it smells good. And it's just perfect to get kids really of any age and size involved, but particularly kids who need something to do with their hands. My goodness, give them something to do with their hands. They're making a snack. So we'll be sure to link to those for sure. And Dr. Effiong, you mentioned often that kids with ADHD symptoms will see improvement, with the right help and support in mind and body. So how are the mind and body both related and separate when you're talking about these struggles?
So, as I've alluded to, the mind controls what the body does, and the brain is our driver. So, when I say kids will improve in mind and body, I mean that literally because if we can get their bodies right, like the example of constipation. So if we get their tummies feeling better, then it feeds their mind, and their mind gets better, and so they're better in mind and body, and the whole family gets better too, because I know parents, I know the struggle, I know the heartache of like feeling like, "Ugh, I can't seem to help my child." But once we can get those two things functioning better, then they do better overall. So
Yeah. Do a lot of people see ADHD and inattention difficulties as purely a psychological, a mind problem, and they don't even look at the bodily functions?
yes, so there's
Mm.
lots of myths about ADHD, and I address those in my reports. People think that it's a made up disorder. People think the kid is just being lazy. People think, yes, the child just doesn't want to listen. So it's a lot of, yes, a lot of, we're looking at the mind, but also just the behavior. They're just doing that. They're just doing that. But the question is, why are they doing that? No, a lot of focus is on what they're doing,
Mm.
right? That they're not doing right, which is always mostly psychological. Yes, it's like, okay, they just don't want to listen. And
Right.
yeah, so
Yeah. Well, and I mean, you're talking about things like sleep and constipation and the food you eat. I guarantee that's not conventional medicine, but it's correct. And you've seen it work time and time and time again. And I'm so happy to share this information with our audience. I know that many people out there are making little lists of the baby steps they're going to try and recommitting, doubling down on sleep for their kids and maybe even, sleep for themselves, which is always something I need to recommit to. But I love to leave parents at the end here with a message of hope. And really, if you could encourage parents in one way, what would you want them to remember?
I would want them to remember that ADHD is not a reflection of your parenting
Mm.
skills. You're not a bad parent, and that ADHD and that your children just need to know who you really see them as, because they really are amazing children. They're gifts to us, and it's very easy to get bogged down in how they're acting. But that know that there is hope. It is possible to help your child become more focused and and just to give yourself grace and know that you are doing the best for your child. The fact that you're listening to Katie Kimball means you're doing the best for you want to do the best for your child. And know that yes, it is possible for your child to become more focused. We just have to look at why they're unfocused. So
Mm. That is, I mean, and that is such a powerful message and a very important reminder that how we see our kids really does frame who they become. Just as your parents told you, don't say no. You can do this. We can figure this out. We need to look at our kids just like that. There's so much potential. And if it's covered over by bad behavior, that's up to us as parents, right? To do the hard work, have the good intentions, and dig beyond the bad behavior to find that root cause. So, such a powerful interview. Thank you so much, Dr. Hokehe Effiong. We'll make sure that everyone can find you and find your information. And I want you need to send me links because you mentioned a couple research papers and white papers and things that you've been writing. So I want to make sure that people can find those too, and your book when it comes out. Thank you so much for gracing us with your presence today.
you are most welcome. My pleasure.
This was great. Families, parents out there, as always, I'm Katie Kimball for the Healthy Parenting Connector. It is my privilege and my passion to connect you with experts who have this plethora of information that you need to do this hard thing called parenting, to be intentional, to do your best by continuing to educate yourself and to see, the beautiful flower, the beautiful potential that all of our kids have, and to commit to growing healthy, independent adults. I will see you back next week with another episode, another expert. Thank you so much.